I'm Dr. Ann Boyd. I've been practicing medicine for 22 or 3 years. I'm double boarded in family medicine and sports medicine, and I've spent all of my career teaching sports medicine, family medicine, practicing in both the primary care environment and the orthopedic environment. I was introduced to Dave by watching him use the GlideCycle, and I've used it myself. I was fascinated by the whole concept of unweighting, and immediately I saw the benefits to not only young athletes who wanted to keep moving, because that is seriously psychologically detrimental to an athlete to not be able to continue in their sport or be around their team. So I thought it was a progressive way to get somebody back into activity. But I also think the world of physical therapy and the world of medicine in general has been waiting for this type of device. The realm of sports medicine, it's very deceiving. It's not just athletes. It's not just very fit people. It's people who are a weekend warrior, people who are elderly, who have arthritis. And I have watched young people have to give up what they love because they have done that for so long and ruined their joints, such as a runner. A runner only wants to run. He does not want to go in a pool. He does not want to necessarily even learn how to ride a bike. He wants to run. And telling somebody who's 40 or 45 that they can no longer run and they have to give up that sport is tremendously traumatic for them. And they can't imagine a life without it. And generally they ignore you until they completely ruin their knee and can't walk. Giving them an alternative to continue in something that they love and allow them to not only continue but to heal and progressively get back to their sport. Their arthritis hasn't changed. It's just their muscles have grown. They've learned how to heal those muscles well enough that the joint functions more optimally. And they can then get back to a sport that they love that a deconditioned knee could not. It allows them another way to continue the activity they love, such as with the GlideTrak or the GlideCycle. Mm-hmm. They can still run. And in the meantime, they're retraining their muscles and allowing the joint to work. I've torn both labrums in my hips, and I can tell you that it was difficult to walk. I couldn't bike. I certainly couldn't run without excruciating pains. There were days that I really was having trouble walking without bending over and holding onto my hip. The GlideTrak allows me to take enough pressure off of the joint, allow a little bit of separation so those bones aren't rubbing, and continue to maintain a normal gait. And again, build those muscles back up so that I now end up with a correctly positioned joint, and allows me to not get out of shape, allows me to not get osteoporosis, and it allowed me to get back to normal exercise. It was the only thing that got me back to normal exercise. I was told I could not do biking. I could not run anymore by my own orthopedic surgeons. And again, I'm in sports medicine, so I know the alternatives that are out there. I know all the research. I know what works and what doesn't. And I know that there are times where I've even had to say to somebody, you really can't go any further. You have to pick a different sport. And for me to say that takes an awful lot, because mentally exercise is a very individual thing. It's a very personal thing. And it allows that particular person to pick whatever is their release. But saying, initially we're going to unweight that joint so that you can continue with your gait and you can continue keeping those neurogenic adaptations and pathways in your head of an appropriate gait as opposed to a modified one because your knee hurts or your hip hurts or your ankle hurts. So combined, as you build the muscles with physical therapy and then continue to build the muscle with continued exercise on something like the GlideCycle or the GlideTrak, you can continue with your activity. It gives them their life back. It gives them their relief back. It gives them a way to handle stress, avoid depression. I believe it can help everybody from a woman with fibromyalgia to stay active and control that activity. Giving somebody back that control is also a very powerful thing and a huge motivator. as opposed to somebody else telling them what they have to do. I believe if I could put one of these devices in every single household in this nation, I believe it can help the healthiest high school athlete. I've seen the gains made on perfectly healthy people with minor injuries. And the mass effect, it's not just one person, it's across the board. It can help somebody with a minor injury get back to their sport faster, and a 14-year-old who's taken out of their sport is, again, a traumatic thing. It's their entire social life, it's their entire self-worth, it's their stress relief, it's how they deal with life. And I think activity is the fountain of youth, to be honest. I think if you can have somebody just be even mildly physical active, it makes for a better lifestyle. It makes the difference between somebody who can't get out of bed and take care of themselves and has to have somebody take them to the bathroom versus somebody who can get up and do it themselves. I think it can help elderly with arthritis. I think it can help middle-aged people who have had a surgical complication or early arthritis because they've done something hard and well. I think it can help younger kids stay in that teen mode and rehab faster. And I've seen it work for myself. I've also recently been told that, because I had my other hip affected with arthritis, that I can't really do anything. And they said to me, what about a pool? And I get bored in pools, honestly. And with that, I have no control over how much weight I'm bearing. So I will never get to full weight bearing. I will never get to mostly weight bearing. The GlideTrak works wonderfully. Not only was I capable of doing it, and at first I used my affected side less in the actual gait, but I maintained the gait pattern, and I felt like I was running normally, but I was not applying as much pressure to the affected side so that I could reduce the inflammation and irritation. So acutely, that's how I used it. And then you progressively bear more weight on it. And then I dropped the speed a little bit so that both legs can be fully engaged in that. And then very quickly you build up to your normal speed. And the beautiful thing is I can read on the treadmill. I can stay on that forever because it's much less effort. But it's the only thing that got me back to activity. And I was really discouraged before that. I really did not think I was going to be able to do most of my activities. I couldn't get out of a chair. Again, I've been in the field of orthopedic medicine as the musculoskeletal side and sports medicine from the primary care side. And again, I'm a big advocate of physical therapy, so I think it could have been improved with physical therapy. I needed something faster, and it got me back, I believe, quicker than therapy would have. Well, I'm almost relatively certain. And I actually didn't require the additional physical therapy. I started with the GlideTrak and then added the GlideCycle. And I think both are required for me to continue to stay as active as I want to be. But I can keep my bones healthy, my muscles healthy, me healthy, and my mind healthy by doing exercise on a regular basis, whether it be 20 minutes a day, half hour a day, an hour and a half a day. I think the medical world has been waiting for this. I really think it is kind of a miracle what it can do. And I think, honestly, it's about time. So not only do I think it can physically benefit people, I think it can mentally benefit people almost equally. They've lost the ability to use that limb, and their brain very shortly forgets how to use that limb. So you can put them on a walker, you can put them on a cane, but if you watch somebody on a walker or a cane, it's a very unnatural gait. I mean, if you took that device out and watched them walk down the street in the same manner, you would wonder what was wrong with that person. That's completely not natural. It's hunched. It's kind of the best they can do with a broken piece of equipment. A GlideTrak allows them to stand upright and retrain their brain, places of your brain that have been damaged and therefore don't allow you to register what a normal gait is. It's kind of taking a piece out of it's like taking your transmission out of your car. The only way to re-engage that and to reignite that is to walk as normally as you can. It's like training a baby's brain. You can. It's a very adaptable region of the brain, except if you wait too long.
Mm-hmm.
There comes a point where if you've waited 5 years, 6 years, that I don't know how adaptable that part of your brain is, but if you get somebody who's had a stroke relatively recently, even if they've been through a year of physical therapy, or ideally closer, so that they can re-stimulate those areas of the brain and have them have a normal gait, yet not have to bear their full weight, you have no ability without unweighting device to get a normal gait in somebody who cannot bear their weight. So you can unweight them and get that gait going, and then gradually adding that weight back down becomes possible. You cannot do it backwards. You can't just add all their weight and then hope that the gait will come. Because by initially putting them on a walker, you've added them as full weight bearing, but you will never walk normally again, and what you're doing is retraining your brain to walk abnormally. You have a beautiful period of time to retrain those neurogenic pathways in your brain and say, this is how you walk. It's just like little kids. You wouldn't train a little kid to walk, like an ape, partially on their hands, partially on their feet, because their brain would get stuck that way. It would say, that's the way I'm supposed to walk. But if you train a child naturally, it will go toward a natural gait. I don't think you can do that if you start with a walker and an abnormal gait and full weight bearing. You physically cannot get back a normal gait, I believe. Everybody has some problem. And say you have complete loss of your left side. With something like the GlideTrak, a therapist can work on it with you.
Mm-hmm.
And if you can't use your leg at all, they can move your leg and just let the treadmill carry it back.
Mm-hmm.
You can preferentially weight one side and just let the treadmill kind of, in a normal gait pattern, lead your foot and have somebody push it forward and it'll follow back. But it's a normal gait pattern that way still. Your legs not out to the side, your legs not unweighted with the rest of your body. So you can actually train someone's gait even without weight bearing. Again, it's the motion that your brain needs to remember. And once that clicks, then you can progress to adding weight bearing. And I don't think any other device out there on the market does this. And I also believe that it shouldn't end at physical therapy. I think, me personally, I think the vast majority of your benefits don't come in 6 weeks, 3 months. I think they come afterwards and in continuing that. And I think even if you took somebody who's just older and didn't have a stroke and put them on this, you fix a lot of the maladaptations that come with age. The hunching, the shortened of the hamstrings, so they have a really shuffly gait. This can not only train you for a normal gait, but train you for a normal younger person's gait. It can stretch the muscles and allow the full range of motion very quickly. So I think it is a one-of-a-kind device. I think it can be used for athletes, young people, minor injuries, major injuries, lifelong injuries, acute injuries of the elderly, or even just issues that come up just by getting older. If you tell me I can't exercise for the rest of my life and you take out 90% of, most of them are weight bearing, but if you take all those away from me, mentally a piece of me would die, and it gives you back your life. It gives people the mental and physical benefits of exercise, and it allows them to see they have some control over it, and I think that's invaluable. But try it for 10 minutes, because I don't know many of my friends, many young people. I mean, I see all ages with all very different problems, and I can think of very few that I wouldn't recommend this to. I mean, honestly, I can't think of any off the top of my head, but I'm sure there's some exception somewhere. So I think it's a miraculous thing that it's about time.
Cool, Ann. Thank you.